I'm Dr. Shalini Nalwad. I'm the co-founder director of ICATT Air Ambulance Services. I'm also the partner for the ICATT Air Ambulance Services. I'm the chairperson ICATT Foundation and the FEM Education, which is a training wing of ICATT, which trains the aeromedical doctors of India. HEMS is the Helicopter Emergency Medical Services, which is very prevalent and which is a necessary service existing across the world, especially in the developed world like Germany or UK, where health is given a very high priority. Coming to India, do we need a helicopter emergency medical services? Of course, we do it. We are already 30 years behind in this service. In Germany, if you look at it, there is a helicopter which is doing this airlifting of the emergency patients, be it be roadside, could it be medical emergency or trauma. There are nearly 1 per million. And if you look at in India, you still do not have a service which is capable of doing this helicopter emergency medical services. So HEMS is non-existent in India at this point of time, and despite having a highest number of road traffic accident deaths compared to other part of the world, it is like 1 per 4, like that is like 1 accident happening every 4 minutes, which are almost fatal. So if you look at any accident, most of these accidents kind of at least 10% of the deaths are fatal, where nothing could save them, and 10% kind of almost walk away without any injuries. But at least 40 to 60% of these injuries are salvageable if we do a timely intervention by the right people or the right skill set and bring them to the tertiary care center with the kind of our concept of a golden hour. The role of an air ambulance is becoming more and more important in Indian perspective. If you, for example, the whole world is becoming a global village, and I think every person has a right to health as we all talk about it. If there is somebody sitting in Siliguri and they have to come to Chennai and they cannot travel by commercial airlines or commercial trains or any other means, the only way forward is an air ambulance. The reason being, we have a wide and geography, and we also have the skill sets, that is like one of the excellent neurosurgeon or a transplant surgeon. They all located in the metro cities. If you have these people sitting in the bigger cities, you cannot take them to Siliguri and ask them to operate, or you can't take them to a smallest village to operate. What we have to do is we have to bring these people to the transplant center or a neurosurgical interventional center. So I and Dr. Rahul Singh Sardar, we both are doctors. As a kind of introduce, I'm Dr. Shalini Nalwad. We both are trained in anesthesia, critical care and aeromedical from the UK. We had a very well established career graph, and but at the same time, when we're looking back at India, we realized the pre-hospital medicine or interfacility hospital medicine really didn't exist. There were a lot of people dying on the roads, or even traveling between hospitals from a small center to the higher center on the road. So we decided to come and establish this service in India. When we came, it was pretty challenging. There was this service existing, but it was fragmented, non-standardized. We wanted to streamline this and bring in the exact same ethos principles what we were trained in the UK to keep the best interest of the patient and do this service. So when this disaster hit us, people were stuck in places where they could not reach the appropriate medical care facility if they needed, like escalation of therapy. This is the time when ICATT played a major role in terms of airlifting the patients in an isolation pod. That is, it's a negative pressure pod imported from Germany, which has got the 100% seal of the virus inside the pod, and it filters the virus and protects the pilots, the airport crew, everyone from exposing to the COVID. I don't think so anybody would actively go and expose themselves to COVID patients. So this is when this is been the scenario, we have to bring this patient in an enclosed cabin where the contact, in terms of there is no 6-meter distance or any kind of a social distancing possible in an aircraft. So when this hit us, we sat down with the stakeholders, convinced them from the pilot to the airport authorities that this could be done in a very safe manner. Not only that, like we did the first isolation pod COVID transfer. Not only that, we have done the highest number of COVID air transfers with the ECMO. The regulatory challenges were there when we came here to India almost 4 years ago. There was nothing like a CAR document, that is civil aviation required document to do HEMS, that is a primary HEMS, that is going on to the patient's side or the roadside and then airlifting them and bringing them back. So of course India is ready with the regulatory regulations now to do HEMS, that is helicopter emergency medical services. And what I'm talking is about the primary HEMS, that is like literally landing anywhere to pick up a patient on flying over the congested areas and things like that. A lot of state governments have coming up with starting this service. Karnataka, Tamil Nadu, Himachal, and of course the National Highway authorities are also discussing with us. We have a training wing which is ready to take off now, that is like aeromedical commandos we call them, who can do anything from a primary survey up to doing a cesarean section roadside. These doctors have been trained. We have 12 doctors and 16 paramedics who are ready to fly, and these are all trained by the world's best, that is the London Helicopter Emergency Services, KSS HEMS from the UK and Singapore. They have sat down, written a syllabus to suit India, to suit the Indian geography, and these doctors are trained for a year, and the training includes training in the UK as well on the real HEMS. They're trained in flying, trained with the regulations, trained with safety, trained by the pilots. The another area where this is a very important role, the air ambulance plays in organ airlift. Nearly 80% of the people die before they get an organ who are registered on organ donation register to receive an organ. So we airlift 90% of the organs in India, and we set in the protocols, guidelines, SOPs, how to airlift an organ, bringing our extensive experience from the UK, where we were involved in the brainstem deaths and declarations and the organ harvesting. We just brought them in and put them all together, and since we became an operation, I'm extremely proud to say hardly any organ has been wasted, which used to be a different story before. It used to be more than 90% of the organ used to go waste due to the lack of air logistics. So that's another area where the government is also very supportive and are enthusiastic to start this service. If you look at the entire Southeast Asia, there is not a single properly established air ambulance service. So when India is looking towards the medical tourism as well, we require more and more aircrafts to connect up the countries where do not have the medical facilities to come to India. This will definitely boost the healthcare. Not only that, we want to start, the reason why we came back to India is to start the HEMS, what I keep speaking about, helicopter emergency medical services, to each and every person who travels on road, or each and every person who is in a medical emergency. And this service, we want to do it as a free of cost, and the cost is not humongous if we sit and work it out. India is not a poor country, it has its own resources, and with the new budget where there is a huge allocation for the health, it should not be challenged as well. This is our future plan is to cover the entire Indian sky with the choppers who are rescuing lives, because life is priceless.